Good evening, everyone, and welcome to Wootton PTSA's February PTSA General Meeting. We're pleased to have you join us this evening. We are going to be covering some of our PTSA activities. Myself, Jessica, and Mr. Nelson will present, and then we'll move on to our special topic for this evening. We're pleased to welcome Beth Carrillo and Dr. Veronica Pay, who will join us for topics around substance use. So we'll move on to the PTSA business first. Wanted to provide a number of updates to you. So we are planning, PTSA is planning an April fundraising event. We put out a survey and it's going to be a student event this year. So we put out a survey to students, got a lot of great ideas back, and our fundraising chair is going through the ideas and we'll be coming up with some option that will be really fun for the students, and we'll be working together with SGA and other student groups to put it together. So looking forward to that, and you'll hear more information in the coming couple months. We went to the Montgomery County Council CIP, that's the Capital Improvement Program hearing earlier this month. It was a great hearing. We had students that testified, or Wootton Cluster Coordinator testified, and it was, they really made impactful testimony about the state of our building and the need for a renovation. So that is the second public hearing that we've attended this year. So we'll continue to work on that, and we will continue to invite some of our political leaders over to Wootton to tour and to see the building for themselves. I know a number of the county council members have been by the building, but we have several others that have not, so we're going to invite them to come. And to that end, we were able to get the county council to provide $15 million towards some upgrades to Wootton to fix some of the ADA issues in the building and some other things. And so there's going to be a community meeting. We've been waiting on this for quite some time. So the Division of Facilities and Construction will be meeting with us on Monday, March 4th. We hope to hope to have a really great turnout for that meeting. It's going to be in the media center in the evening. I think it's at 7 o'clock. I know I put it in the newsletter. So more information to come on that. You should be seeing some information in your emails from school very soon about that meeting. And we do want to have a strong turnout, so we can engage with the Division of Facilities and Construction on the updates that they plan to do over the summer, this coming summer. The SGA is going to be doing a spring activity. It's called Wootton Gives Back. It's going to be an event on Friday, I'm blocking my date here, March 15th. And they are asking us to support the event again this year with donations of water and snacks. We'll put out something just a couple weeks before, so I guess starting next week, and then donations can be made into the front office so that it'll be there for the students when they have the event on Friday, March 15th. So stay tuned for that. We have one of our PTSA partner sponsors is doing a pre-college summer program fair at Wootton on Thursday, March 14th. These are schools that offer summer programs. Some of the schools would be like Georgetown and University of Maryland. I think Duke, some other schools that will be coming to talk about their summer programs. Where students go, they stay in the dorms on campus, and these summer programs are pretty popular, and we have a lot of Wootton students go to them. So they decided this year they're going to offer the fair at Wootton. So we'll be all open countywide, but we're hosting it on Thursday, March 14th, and it will be a presentation at 6, and then from 7 to 8 will be an open house, and students and parents can go around and talk to the various schools about their programs. Our next PTSA meeting will be coming up on Tuesday, March 19th at 7 p.m. And the topic for that meeting is going to be the new digital SAT. So for those that have students that are preparing for the SAT, you probably heard about the new digital SAT. We have an expert that's going to come and provide more insight into what that is and help us understand what changes there may be from the written SAT to the digital SAT, besides just being on a computer. And then we'll also have a conversation around internships and summer employment, and that's perfect timing for that. So we hope that you join us for the next PTSA meeting as well. Let's move ahead to the next slide. We have 2 restaurant nights coming up for one of our groups at Wootton, nonprofit groups at Wootton that helps to support the school. That's the Patron of the Arts. They support the arts programs. And so they have a restaurant night on Thursday. That's at Lido Pizza. Just let them know that you're from Wootton. And so they will provide some percentage of sales to the Patron of the Arts that will support our arts programs. And then Tuesday, March 12th will be Chipotle. And that tends to be a real popular one, also supporting our arts programs. We can go to the next slide. I'll turn it over to Jessica.
Hello, good evening, everyone. So just a reminder that our next principal's coffee chat is this Friday at 9 a.m. The email will be going out tomorrow morning to ask for advanced questions. But you're always welcome to email me at the email address on the screen. And we will be hosting this session. I did want to give a heads up to everyone. The next principal's coffee chat will be earlier in the day because of a conflict. So for those who are our regular attendees, the March session will be at 8 a.m. instead of 9 a.m. And it's also earlier in the month. Typically we have them the Friday after our PTSA meeting, but because of the spring break schedule, we are hosting the Principal's Coffee Chat on March 15th. So just want to make sure that you're aware, earlier in the month and earlier in the day. And with that, I will hand it over to Mr. Nelson.
Good evening, everyone. Nice to be with you, and my apologies for being a little late. I had a new block on my Zoom that I have never encountered before, so I had to use some of my tech skills to get around that one. But it's really nice to be with you, and I'm glad that I'm able to provide a few updates to keep you informed about the great things that are happening around the school. Just a little note that next month, I made a request to Brian, who was very happy to oblige. MCPS, we really believe that we want to continue to update parents about our work around the school improvement plan, which of course is very critical to our work and what we're doing to always get better when it comes to instructing our students. But recursively, we want to come back and give some updates about what we've seen, what data we have looked at, some adjustments, as that is really a living document. You want to adjust your school improvement plan on an ongoing basis, not only to inform the actions that you take, but to make adjustments based upon what you see. So I'm going to work with Ms. Rice, who is our staff development teacher, and we're going to prepare a brief update about the school improvement plan. There are some parents that I received questions, really thoughtful questions, and other parents that just engage with me around the school improvement plan. So if you've been following that for us throughout the year, please make sure you mark your calendar for next month's meeting, as there will be an update on where we are with the plan. I'd like to invite everyone on the Zoom that if you would like to see our Black History Month program, it takes place this week. It is going to happen on Thursday at 6 p.m. in the Commons. I'll repeat that, Thursday, 6 p.m. in the Commons. This year's program is titled Unsung Heroes. And if you have come in the past, or if you might be going for the first time like I did last year, it truly creates an impression. Not only do I think that it's worthwhile to come out and see all the creative approaches, performances, all that our students do, which I'm always so incredibly proud of them, but I think it really, truly celebrates a focus for this month around Black history. So if you have some time on your schedule and you can join us, we'll see you at 6 p.m. In the Commons. I will certainly be there. I wanted to share with everyone this week we have an event taking place at Wootton that is a first time event for our school. And this is called an expert review team visit. And you might be seeing the flow of information that is coming out to the community around the expansion of not only programs, but different ways in which the state of Maryland is supporting schools around our blueprint for excellence. And this is one of them. So I just wanted to let you know that beginning tomorrow, early morning in the College and Career Center, I'm going to meet 6 visiting educators that will come in from Wootton. They've been trained by the state of Maryland, and they're going to spend time in our school building doing a number of specific tasks, whether that's meeting with focus groups, including staff, students, and parents, whether visiting classrooms to take a look at what happens by way of instruction across numerous contents, according to the look-fors that have been provided for this experience. We're going to engage with our expert review team, and they're going to visit our school for 2 days. So I'm really looking forward to kind of seeing what this experience is like, since we are one of the first schools in the state to go through the experience. But more importantly, I think what I want to share with you all, what I think is very important, is the outside perspective that we will get from an experience like this. We, of course, work together. We collaborate continuously. We want the best for all of our students every single day, but an outside perspective is really an opportunity to kind of see what others may see, and it truly is about improvement and growth. So I am really looking forward to seeing, weeks or a couple months out, we'll receive a report that we can actually take a look at as a school team and kind of look at what their findings were, recommendations that they're going to make, and it's also going to affirm the strengths that come through this review, and I'm interested in seeing those as well. So our expert review team will be visiting this week. MCPS is, I received as a staff member on Saturday my survey, but they will be pushing out to, once again, students, staff, and parents surveys that will be coming your way. This is our annual climate survey. This process has been in place for a very long time. And so I just want to encourage everyone. These surveys are used. I think sometimes we experience like, oh, there's another survey. A little bit of survey fatigue, because we get asked oftentimes to give feedback or input about what the experience is like. I just want you to know annually our ILT really looks at the survey results. We study them and really come up and take a look at what ideas can we employ to always be improving upon our climate and overall experience at Wootton. So if you receive one of those, I want to put it on your radar. And if you can give about 5 minutes to respond to that, I would really appreciate it, and the whole staff at Wootton as well. And last, I would just like to send some big congratulations out to our music department. You might have heard the Acatonics have been off to a number of performances. That's our a cappella group, and they've come back winners every time. It's been wonderful to see them perform and just kind of see the joy that comes out in that performance. But we also received great news this week that we have many Wootton students from across our choral and instrumental groups that are going to state performances, that's a high mark in order to be invited to perform to kind of the most elite ensembles that we have in the state of Maryland, which is really great news. So I'm very proud of our musicians and our performers. And I also want to wish a lot of luck to our winter athletic teams that are moving into their playoff competitions. Some of them are already there and competing. So I hope that we have a lot of good news to celebrate in the athletics department as well. So those are my updates, and I'll go ahead and throw it back to Brian.
Thank you for those updates. All right, well, now we're going to move on to our special presentation for the evening. So first of all, I'd like to thank Ann Eversley, our school community nurse, for bringing this great program to us. So tonight's topic will be on substance use, really important topic. And so we have a 2-part presentation this evening. For our first part, I would like to introduce you to Beth Carrillo from the Caron Treatment Centers. So Beth has joined Caron Treatment Centers in 2022 as a student assistance program specialist with over 15 years of experience in education and social services. She's passionate about providing substance use prevention programming to both students and adults. She also facilitates early intervention programming, including psychoeducational support groups for students who are interested in changing their cannabis and nicotine use. She holds a bachelor's degree from Boston College and a master's degree from the University of North Carolina, Wilmington. And now I'll turn it over to Beth. Thank you, Beth.
All right. Thank you, Brian. And thank you all so much for letting me or giving me the time to present. I know that you are all very busy. So I will try to make this short and sweet and informative. Um, again, so during this program, what I'm going to hope to do is share some of the latest statistics and trends in youth substance use, but more importantly, share some tools, tips, and resources so you can help your teen make healthy choices. Just a little bit about Caron Treatment Center. So for 65 years, Caron Treatment Centers has helped individuals recover from addiction and mental health disorders with both inpatient and outpatient programming. But I think what really makes us unique is Caron's Education Alliance. For the last 30 years, we've partnered with schools and community organizations to provide substance use prevention and intervention programs. The idea being, let's get to kids before they develop a serious substance use problem. And we've been working, in Maryland for almost 20 years. So as I briefly described before, my goal is for you to have a better understanding of the science of addiction and teen brain development, current trends, including the risk and protective factors, and then discuss some best practice approaches for preventing teen substance use. So let's just take a minute to think back to our teen years. How did we communicate with our friends? How were substances spoken about? How are they consumed? And now think, what is it like for teens? We know that kids are spending more time indoors. We used to have landlines, and now teens have cell phones, social media, vapes. If I mention those to a teen, they're like, ew, gross. Cigarettes have definitely been replaced with vapes. But also we have a lot more information about substance use. So as we move through this program, I just want everyone to think about the lens that teens have now as far as trends, methods of consumption, and potency, because a lot of things have changed since we were teenagers. So adolescence. Let's start by focusing on the developmental period of adolescence. We know that this is a period of intense brain development. And during this stage, taking risks is normal. These risks teach our youth to, become adults. And during this time, the brain is not fully equipped, like with the brakes. We like to say, like, their prefrontal cortex is not fully developed. And therefore, they're likely to make kind of impulsive decisions when it comes to substance use. And it's a critical period for the risk of addiction. Because teen brains are wired to learn new things, substance use during this critical time changes the structure and functioning of the brain. So what we know, if someone waits to use a substance until after the age of 21, their risk for addiction goes down. It actually decreases significantly. So let's talk about substance use trends. So a lot of this data is from Monitoring the Future, which is kind of the gold standard when it comes to looking at substances and teen use. And we're in for a treat because the 2023 results were just released. So we're going to be looking at the latest results. And what Monitoring the Future does, Students in 8th, 10th, and 12th grade take this survey. The schools opt into it. So if a child is not at school, they don't take the survey. So, we really do look at this as the gold standard, but know that, it could be a little bit higher when they're reporting their substance use. So the most reported teen substances use, it held steady in 2023. It held steady, which means below the pre-pandemic rates reported in 2020. And as you can see in the lines, it's 8th, 10th, and 12th grade. And what we really want to focus on today is the most commonly the commonly used substances, which is alcohol, nicotine, vaping, cannabis. So what I like to note is, looking at alcohol, about 15% of 8th graders have tried it in the last year, and 45% of 12th graders. So those 4 to 5 years shows the older our kids get, the more likely they are to be exposed to substances. Therefore, having these conversations early and often is extremely useful. What we say, it's not one conversation for an hour, it's 100 conversations for a minute. And the most commonly used substances, marijuana, nicotine, alcohol, they're easily available and mostly legal. We know in Maryland, cannabis, marijuana has been legalized. And teens these are the substances that they definitely commonly use. And because they're perceived as less risky, they've been normalized, they've been legalized, unlike what people perceive as harder drugs. So when we look at alcohol, it's pervasive. We see it in advertisements, marketing, our social cultures, family gatherings. But also alcohol has changed. These gummy bears, they have alcohol in them. And a lot of times you can find, as you see in the pictures with like the Truly spritzers, they have fruity flavors, which we know that teens tend to gravitate towards. And it also can be consumed very discreetly, as seen in the picture, with the girl with the bracelet. That's a way for her to drink. And then alcohol. The past year, the use remained stable for 8th and 10th graders, but it actually declined for seniors pretty significantly, compared to 51% in 2022, and in 2023 it was 45%, which is really, really good news that these rates continue to decline. But what we do know is when there is underage drinking under 21, the youth or teens tend to do it more intensely and consume more alcohol within a short period of time. Actually, 90% of all alcohol consumed by youth occurs in the context of binge drinking. And what binge drinking is defined, for a female, that's 4 drinks. And for a male, it's 5 drinks, within a night or a short period of time. And one stat that we know is youth who start drinking before the age of 15 are 5 times more likely to develop alcohol dependence or a substance use disorder. And in addition to impacting the brain, alcohol is toxic. It damages the structure and function. We know that the brain is fully developed at 25. And right now is a really important time for the development of the prefrontal cortex. And alcohol also can reduce inhibitions, impulse control, and can contribute to self-harm or suicidal behavior. And it worsens the symptoms of anxiety, depression that initially could lead some people to drink. And now let's talk about vaping. So, a lot of times teens talk about vaping and it's like the vapor. It's not vapor. When I think of vapor, I think of like a humidifier. What people are inhaling with vapes is more like aerosol. It's like that sticky substance. And the next stats are coming from a different survey, but what we're seeing is while vaping has decreased with high school students, it has increased with middle school students. And this again is for the year 2023. Let me keep moving. And, according to the National Youth Tobacco Survey results, right now, the most popular brands are disposable. It's no longer rechargeable. And the disposable brands, are easily purchased either, at a convenience store, gas station, online, cheaper than a rechargeable device. With Alf Bar being one of the most purchased and used. And about 9 out of 10 teens use flavored e-cigarettes, usually something sweet, dessert, candy type flavors. And a few more of the key findings is that when it comes to like frequency of use, more than 1 in 4 of current youth e-cigarette users use an e-cigarette product every day. And then more than 1 in 3 report using e-cigarettes at least 20 out of the last 30 days. So what we know about vaping and nicotine, it's highly addictive and it is very, very hard to quit. So, I had showed a picture, well, I'm going to be showing some pictures of the Alf bars and other products. And, one of these devices is equal to 2 packs of cigarettes when we're looking at the nicotine content. And some are even more potent than that. They have the nicotine levels of, 3 packs of cigarettes, which is like 60 cigarettes. But it's a lot easier to consume. And also, as you can see, it's the flavored, it's all, bright colors. It can look really appealing, sleek, cool. And it's been marketed that way, intentionally by these tobacco companies. And another one of the findings from the survey is that flavors with like ice tend to be more popular, which, I thought was pretty funny. And then when it comes to reasons for first use, and these are the same reasons I get when working with teens who are trying to quit their nicotine use. It's like, why did you do it the first time? How did that happen? And it was never like a premeditated decision. I'm going to vape today. Their friends were doing it, or they ended up in a situation where they saw someone vape and they were curious and tried it. Other reasons that we get is anxiety, stress, tricks. So there are a lot of reasons that teens use, but I think, the top 3, friends, curiosity, anxiety, when I'm speaking to my children about it, would be the ones that I would like to, really lean into. And I also wanted to mention oral nicotine products because they have become more and more popular. And this isn't like the dip or like chewing tobacco that was around, 20, 30 years ago. These Zyn pouches are clean. You can put them in like the lip and they can last for a long time, where people are just getting like constant stream of nicotine. And nicotine is a stimulant. It keeps people focused, going on. It helps, or reasons that people do it, like it makes them like stay focused, energy levels improve. And these are not prescribed therapies like Nicorette. And they come in flavors, candy-like packaging, so they appeal to teens and have very high nicotine content. Oh, sorry. Excuse me. And we know there are a lot of risks when it comes to nicotine. And, some of the teens that, both seen like when I work with them as well as in the surveys, don't necessarily think about using nicotine when using vapes. And this increases the likelihood of addiction. And we know nicotine is one of the most addictive substances out there. It structurally changes the developing brain. It can increase the risk of addiction to other drugs, impact attention, mood, learning, impulse control, and does worsen anxiety symptoms. A lot of those symptoms, like they're like when teens or people say like, I smoke because it helps my stress, those are really just withdrawal symptoms. And I wanted to talk a little bit about marijuana, cannabis. So the plant is called cannabis, and the active ingredient that causes the high is THC. And usually marijuana is referred to as, the substance that contains THC. There's also CBD that has been touted for a lot of medical benefits without the high. CBD is not regulated. So if it says like it's 0.03 THC, it could be more, it could not have any CBD. So that's another thing. It's kind of can be like the wild, wild west when it comes to monitoring marijuana, cannabis, CBD. So marijuana is a mixed action drug, which means it has components of stimulants like cocaine, Adderall, depressants like alcohol, and then hallucinogenics, which can cause any type of experience when used: paranoia, anxious, energized, kind of a relaxing, chill out experience. And it can also cause teens to disassociate from reality. And when looking into marijuana from the years 2017 to 2023, it has been increasing. With 8th grade, it's been a 3.5 increase, 10th grade, 5% increase, and 12th grade, 10% increase. And we're seeing, it's becoming more normalized, which is a reason that I think the use has increased. And as far as cannabis, I did want to read the quote on the slide. Unless you've consumed a THC-based product that was commercially produced in the last couple of years, your construct of what cannabis is so antiquated that it's pretty irrelevant. So when we talk about the cannabis, marijuana, today, it is completely different than what it was before. So let's look how it's different. So if we're looking at, 60s, 70s, there was about 0.5 to 1% THC. In the 80s and 90s, 3 to 4%. And now the green like the actual like dried flower, the average is about 16%. However, it can go up to 80% depending upon like what someone is buying at a dispensary or on the street. And then there are also oils, waxes, concentrates that can go up to 99% THC. So it has been engineered in labs to be much stronger. And because of this, emergency room visits have skyrocketed with, psychosis, paranoia, hypermesis, which is basically uncontrollable vomiting. And there are a lot of ways to ingest marijuana. Vapes, it can be, in the picture, with the glass vape, it can be combustible as well as vaporized. And with the dry herb vapes, it usually contains, a battery that's rechargeable. Just to get an idea of all the different types of devices that are around. And then when we look at THC wax dabs pens, these would not have as strong an odor as traditional dry herb, but it still has the smell. And they're called rings, and these types of tools are used to kind of get like it, it's think of like a wax type consistency. And these are very, very potent. And I also wanted to take a quick minute to talk about THC oil pens. And I think that these tend to be a little bit more popular than the waxes and dabs because they're pre-filled and can be ordered online or at a dispensary and have very, very high levels of THC. And a lot of times, they're called carts and a little bit cleaner. So when we talk about withdrawal symptoms in relation to cannabis, some of the things to look for is insomnia, sleep disturbance, appetite changes, depression. A lot of times cannabis use disorder is being diagnosed as severe depression, restlessness, irritability. And we know there are a lot of dangers of cannabis use, both short-term and long-term. Some of the short-term consequences is impaired motor skills, memory, learning problems, because the THC attaches to the fat cells in the brain and kind of causes interference when teens are learning or trying to create either short-term or long-term memories. Panic attacks, hallucinations, paranoia. There's a word now for it. It's called a green out. Similar to like a blackout, and I've heard this from teens, that they might use too much or it's a very high potent cannabis where it causes them to green out, which means it can mean a variety of things, like just not remembering what happened to having like paranoid thoughts, as well as the hypermesis that I mentioned, which is, uncontrollable vomiting and diarrhea. And then long-term, those, what we used to think as like, the health impacts of cigarette smokers, that chronic cough, bronchitis, exacerbates asthma symptoms, and can even lead to schizophrenia and psychosis. And also fertility and reproductive problems, because we know in addition to the brain, a large concentration of fat cells are also in the reproductive organs. So, can be impact that as well. And, another thing that's changed is more adolescents are seeking treatment for marijuana. And that wasn't necessarily the case in the 90s. A lot of teens, like that was not their drug of choice when seeking help with substance use. And what we do know is use before the age of 18 means 4 to 7 times of a higher risk of cannabis use disorder. It's just delaying use, which is part of the reason, 21 is the limit, is the age. So now I'll take a little time to talk about prescription and over-the-counter substances. These are not as commonly used as the substances I spoke about earlier, but it includes Oxycontin, Xanax, Adderall, some of the prescription codeine syrup, or cough medicines, as well as over-the-counter cough medicines. And if it's not being used as a way as a doctor prescribed, then it's being abused, and someone has the potential of becoming addicted. And I know Dr. Pei is going to speak about fentanyl, so I won't take too much of my time with fentanyl because you'll hear more about it. It's a hot topic. One pill can kill, but fentanyl is a synthetic opioid that is 50 times stronger than heroin, 100 times stronger than morphine. And you can see in the pictures, this is the actual Xanax and that's the fake Xanax. A lot of counterfeit fake pills are being cut with fentanyl because it increases addiction, it's cheaper, and it gets people the effect they're looking for. And I also want to say there have been some reports, even in this area, where fentanyl has been found on both dry marijuana, the flower, and, carts, the oils. And there has been a dramatic rise in overdose deaths. And here are some of the signs. And again, I don't want to spend too much time because I know Dr. Pei will be speaking about fentanyl and overdoses right after this presentation. When talking about substance use, it can get dark quickly, but there is good news. Most youth are not using substances. According to the surveys, over 60% of 12th graders report abstaining from use of cannabis, alcohol, nicotine over the last month. That's almost 77% for 10th graders and 87% for 8th graders. So we're seeing that, like, when, adolescents delay substance use, like even, 1 year can make a big impact. So what can we do? Let's look at some of the protective factors versus the risk factors. So one of the biggest risk factors is family history. So a family history of alcohol or drug problems. It could be a grandparent, parent, uncle. It's genetic, but we don't know why some of these genes become unmasked in some children. Also, untreated mental or behavioral disorders can lead to someone being more at risk for developing a drug or alcohol problem. High adverse childhood experiences. This could be abuse, household dysfunction, or a traumatic event like witnessing a car accident. impulse control are some of, the risk factors. And then on the other hand, the protective factors, having healthy role models, strong school connections, being involved in music, sports, and having little or no access. And, our kids knowing like their parents really do disapprove. So key prevention strategies, what can you do? Talk early and often, consistent messaging, and ask for help. So what does that look like? We know caregivers are the #1 influence on a child's relationship with drug and alcohol. And the main way to prevent addiction is to keep kids from using addictive substances in the first place, delaying as long as possible. And here are some conversation tips. Be calm, relaxed, clear about your views, not lecturing and being positive, and knowing what you want to accomplish. So again, if you're a car is a great place, as I'm sure you know, to talk to kids because they can't leave. And so like if you're driving and hear a commercial that has some type of reference to substances or a billboard, just being like, oh, did you see that? What do you think about that? And making it more natural. So these conversations are best, especially when they aren't scheduled sit downs, but more relaxed. And, our kids will get used to hearing it over and over. And then, different ages, the conversation should probably look a little bit different. Practicing refusal skills. So as I mentioned before, most kids say that, when they tried vaping for the first time, either nicotine or marijuana, it wasn't premeditated. It was just like more of an impulsive decision. And we know more likely than not, a child is going to be encountered by substances, whether or not it is, at the park or, at a party, wherever. So practice those refusal skills. Ask them, how are you going to handle it if, you see some of your friends vaping? How are you going to say no? And help them separate reality from fantasy. A lot of times these substances are glorified in social media, TV, and other avenues. And then, in the real teen years, 13 to 18, establishing real rules and consequences. If you do this, this is what happens. You'll be grounded. You will lose your phone. But also, try using open-ended questions, and, praise the great things that they're doing. And I know, as a mom, whenever I ask my kids, how was your day? I get like 1-word answers. So we have some alternatives, like what made you smile today? If you switch places with your teacher tomorrow, what would you do? In hopes to get them to talk more, rather than, just giving kind of 1 word, fine, school's good, boring, whatever they may say. And other possible conversation starters is, if there's drinking at a party, what would you do? What are you and your friends looking forward to this year? Also, maybe having a code word. If they're at a party and don't feel comfortable, like, having a code word with them. So, like, it's time to like get them, or, I'm going to call them so they have an excuse to leave. And then, sometimes it can be the dreaded question, but did you drink or use drugs when you were a kid? This can be a really hard question to answer. But remember, this isn't about you. There probably is a reason that they're asking it. So maybe asking them why, why do you want to know? Why are you thinking about this? It's a personal decision whether or not you want to go there with your child. But I think, obviously honesty is the best policy. And what, sometimes at Caron we say is, everyone has had an experience with someone, whether or not a family member, a friend who struggled with addiction and substance use. So maybe having them as an example and being like, you know what, I tried alcohol. But as you know, my friend John, struggled with alcoholism for many years. And I was lucky, I wasn't addicted and I didn't continue using in a dangerous way, but he did. And I can't promise you that you're going to be like me. The earlier you start, the more likely you are to be like John, who has an issue with substances. So, really think about that conversation because it can be a teachable moment, but it also can be a real nerve-wracking conversation. And then some things to pay attention to: physical changes, productivity, like energy levels, like high to low energy, sleeping patterns, weight changes, slurring speech, red eyes, as well as, the obvious like evidence of paraphernalia. And if you suspect use, take action. If something feels wrong, trust your gut. It might be. Ask your children if they're using drugs. Expect that they're probably going to say no, but give them the opportunity to be honest, and you can investigate further. And there are a lot of resources. I will show some in the next slide. And also at Caron, we're always here to help you if you're suspecting use, and there are other resources throughout Maryland. And here we have a lot of digital resources, everything from, 3-minute conversations about how to speak to your children about substance use, to other online courses. All are grant funded and free of charge. So I can give that information to Miss Eversley or Brian if you're interested. Or you can use one of these QR codes, and we also have the information on our website, caron.org. And lastly, here's a QR code. So I'd love to hear your feedback, what was helpful, maybe what wasn't helpful. We're always trying to make these programs better for parents and caregivers. So honest feedback is always appreciated. And thank you so much for your time. And I really appreciate you all listening. Thank you.
Thank you, Beth, for that excellent presentation. Do we have any questions from anyone? Beth, I do have a question about back in the 80s, a long time ago, there used to be lots of PSAs about not doing drugs, and one that was very memorable was a sizzling pan in your brain on drugs. And I don't see a lot of marketing around not doing drugs. Do you see a lot? Is there information out there on social media? I don't recall seeing anything on TV.
Yeah, like the whole, DARE campaign, that actually, when evaluated, it wasn't extremely successful when preventing substance use. So I think, as prevention specialists, we're kind of going a different route, which is like just giving the facts. And that's what we try to do, at Caron, and like help students with resiliency skills so they can make healthy choices. But yeah, I don't think those campaigns like on a national level or government funded really are happening right now. And a lot of the money that's going for substance use is not going to prevention. It's more, when you think about like, where's the money when it comes to substance use, it's like opioid prevention, rehabs rather than prevention.
Interesting.
Yeah.
A lot of the things that you shared are like the different ways that teenagers can access substances. I haven't seen so many of those. Those are just, I've never seen those before. So as a parent, the carts, as you mentioned, and things like that are just really new to me. So I think parents, we need a lot of education around this topic.
Yeah. It's always changing. It's a continuous, like these products are being updated, and not that I'm recommending, but if anyone ever goes to like a smoke shop, kind of seeing what's there, there's kratom that can be used as like an opioid replacement. Like there are so many substances that are synthetic that are able to be sold, like skirting the laws. And kids are smart. But the good news is most kids aren't using substances.
Yeah, that is that was good to see that stat. So thank you. Any other questions from anyone before we move on to our next second topic? All right. Beth, thank you so much. We really
Thank you.
appreciate it.
My pleasure.
And we're gonna move on to the second part of our evening, which is about opioid treatment. And so we have Dr. Veronica Pei here, who is an active duty emergency physician in the U.S. Public Health Service with over 20 years of experience working in inner city emergency rooms. Prior to her commission, she was faculty at the University of Maryland School of Medicine for over 15 years. She currently works clinically at the Walter Reed National Military Medical Center and also as a volunteer physician at the Chinese Culture and Community Service Center. As a parent of a Wootton graduate and current Wootton junior, she's passionate about overdose prevention and is the training director for the Chinese Culture and Community Service Center Overdose Response Program. In this role, she leads a group of youth trainers, including high school and college students, and has provided training for over 150 participants. And now I turn it over to Dr. Pei. Thank you.
Thank you, Brian, for that introduction. And I apologize, I have the flu, so that's probably losing my voice a little bit. Can you all see my intro slide?
We sure can.
Okay, great. So before I get into the introductions, thank you again for having us today here to talk to all the parents about opiate overdose. And I have a QR code here on the opening slide, and this is just to help us with our QA process to look at how effective our training is. And if you are able to and have the opportunity, if you could scan the QR code with your phone. And we'll also put this link later on in the chat so that you can use it if you're on the internet, and you can use that if you don't want to scan it with the QR code. So this is a training on opiate overdose response. And I'm here with two of my trainers, Ethan, who's actually a junior at Wootton and who's been helping me train, as well as Isabella, who's a college student at College Park. And we are hoping to basically bring the word out to the community and try to leverage peers to help us in this training. So you heard about me and what I do. And like I said, I've been an ER physician. I've seen lots of people with opiate overdose who comes into the ER presenting with overdose symptoms. And I treat a lot of patients with opiate overdose acutely. But I want to also let my two other trainers, Ethan, introduce himself. Ethan.
Hi, everyone. My name is Ethan, and I'm a junior at Wootton.
And Isabella. Isabella's on.
Hi, everyone. My name is Isabella, and I'm currently a junior at University of Maryland.
And they'll be actually helping me to teach, because the goal of this is meant for everyone, but especially our target audience is actually to do outreach to high school and also college students who are youth who are particularly at risk. So this is going to be very interactive. I teach a lot, so I leverage a lot of interactive tools. I don't know if you ever used Poll Everywhere, but this is a link that we'll put on a QR code that you can also scan. So throughout our presentation, we'll have some opinions and questions for you just to gauge just to have some interaction with the audience, because I know that anytime you do sort of attend any sort of informational session, it is hard to sit on the other end of the Zoom. So we want to try to make this interactive, and there's no judgment. If you don't feel like using this, you can also shout out the answers, and please feel free to put questions in the chat if you have any questions. I'm happy to answer them. So as I said, this training is intended for anyone who's interested in the topic. You don't have to have a medical background. This is totally for the layperson. Again, I have students who are participating as instructor with me on these sessions. And you don't have to know anyone who's used opioids, but it's just really helpful to be informed about situations. And it could just be for anyone who just wants to learn more about the topic and is interested in helping others. So our first question is, the first word that comes to mind when you hear someone say opiate overdose. And you can either use the link that's up there, or you can use the QR code with your phone, and you can type in some words that that comes to mind. And this is just a word cloud, so. Or if you want to, you can shout out an answer in Zoom if you don't want to use the QR code or anything.
It's Mr. Nelson. I would say scary.
Scary. Okay, well, yeah, I think it's a word that we hear a lot about in the media, but maybe we hear about overdoses. Okay, I see somebody saying death, frightening, great. Answers are coming in. We associate overdose with death, and we'll be talking a little bit more about that and scary. Okay, fentanyl, I see that. We've already heard the term. Beth was introducing in her talk about fentanyl as a substance of use. And I want to say, well, why is this important to you? And not only as parents, but even to our youth population, right? If you look at these are some articles I pulled out just on the internet, and you can see that teens in high schools are facing overdose. And you can see in this particular article, the statistics are pretty scary. They looked at young people aged 10 to 19 years old in the United States between 2019 and 2021. And you can see that overdose deaths amongst that population increased 109%. And then specifically death involving fentanyls, illicit manufactured fentanyls, increased 182%. Now, I'm sure part of this is probably, this also was during the pandemic, where we know that there was an increase in mental health issues as well as substance use. But this whole statistics to me, I think is really, really scary. And you can see that in the LA schools, they're allowing students to carry Narcan. And we'll talk about Narcan a little bit later. But you can see that students are actually being criminally charged. In this particular case, there's a teen girl. She happened to give her friend a pill after an exam to help her relax. And what happened was the girl overdosed and died because she didn't know that that pill was laced with a substance, which is fentanyl in this case. And the person that gave her the pill is being charged with murder. So you can see that there are potentially serious consequences and that this is happening in our community. And specifically to Montgomery County, as I was looking for some statistics on Montgomery County, you can see that 5 students died, and this is from March, right, of last year. 5 students died from opioid and fentanyl overdoses this school year. So that would have been, from the beginning of September to March, that would have been half the school year in Montgomery County. And that they've already had to administer naloxone 13 times for suspected overdose. So again, we know that this is in our community, right? And I want to show this brief clip. Again, I'm using some media, but just to show you, what are the kind of kids that is experiencing overdose, right?
A local teenager dead from the suspected fentanyl overdose, and now Prince William County police are addressing how they are trying to combat fentanyl dangers. Our Tisha spoke exclusively with the teenager's family, joining us live tonight from Manassas with more on that. Tisha. 17-year-old Christopher Curry Jr. grew up in this Manassas neighborhood playing basketball and also skateboarding in this cul-de-sac where we are tonight. And by all accounts, he had everything going in his favor. An honor student at Osborne High School, a job, and a bright future ahead. After graduation, he was planning to study engineering at Morgan State University. It all came to an abrupt end nearly 2 weeks ago when his father says he discovered the 17-year-old lifeless in his bedroom.
So I'm just going to show the beginning of the clip because I want to kind of bring home a message that when we think about drug use or substance use, I think the first image that comes to mind is maybe somebody who's, who is used to using substance. And I think Beth mentioned some of this in her presentation, is that our kids are actually exposed to this. And you saw in this case, this is close to home, right? Not too far from where we live. And this kid was a normal high school student who was an honor student, who had a bright future, who played sports, who had a job, could be like any one of our kids at Wootton, right? And this does not have to be somebody who is potentially a delinquent or who had, who was especially poor socioeconomic status or anything that are risk factors for opiate use. They're not they don't meet the classic sort of at-risk population. And these are just regular kids. So I want to just hit home that these situations are going to happen. Our kids are going to be exposed to it, whether we want them to or not. And they don't have to be sort of chronic users or be kids or be around people that use this a lot. It could just be any sort of random chance. And I think it was also mentioned, Beth, and you'll see from stats later that really a lot of these are just accident. And we just have to be informed and teach our kids to be aware of these situations that they can run into. So I'm going to just skip to the next slide. It's urging. Okay, so what we're going to talk about today is just a little bit of background. Again, this is for non-medical people. So just to understand what opiates are, and the current statistics in Maryland that will share some of that with you, signs and symptoms overdose, and how to respond. So I'll start with first, what is an opioid? And can somebody name an opioid, a substance that's an opioid? Shout it out if you like. Has anybody heard of an opioid substance?
Fentanyl.
Fentanyl, okay, we hear that a lot. Other things, anybody else? Anybody who's taken an opioid or been prescribed an opioid?
Oxy.
Yeah, OxyContin, right? These are common drugs that are actually prescribed to people after surgery, right? Doctors prescribe these all the time. If I saw a patient with a fracture, I'm going to prescribe a painkiller. And all these are considered opioids, right? And so there are typically two types, okay? There are the ones that are derived from the poppy plant, or they're synthetically made. So, for example, morphine is derived from it's opium derived. And then something like heroin and fentanyl, they're synthetic, right? They're man-made, all right? And the effects are really pain relief. That's the primary reason we prescribe opioids. There's also euphoria, which is the sense of feeling good, feeling high, right? And that's really what the addiction is for, right? And then it can also cause drowsiness and respiratory depression, which slows down your breathing. And that will become, and that's important to remember, right? So these are examples of prescription opioids that you might see. The most common one we hear are oxycodone, OxyContin, morphine, but sometimes names can be misleading. For example, if you look down here, you'll see Tylenol. Tylenol number 3 and 4. I think most of us, when you hear the word Tylenol, you don't associate that with an opioid. And in this case, if you see that Tylenol number 3 and 4, any Tylenol with a number behind it, number 2, 3, or 4, they have codeine in it. So that means it becomes an opiate, even though Tylenol itself is not an opioid drug. So we prescribe this a lot in kids as well. So, just because the word says Tylenol, it may contain substance in it that are opioids. Now, fentanyl. So fentanyl, why are we concerned about that? So I think Beth also mentioned it in her slides a little bit, but we're more worried about this non-pharmaceutical fentanyl. The reason we're worried about it is pharmaceutical fentanyl is really, it's a controlled substance. So it's manufactured by companies meant to treat pain, and it's approved by the FDA, and we know what goes into it. its manufacturing is strictly regulated. So you know the concentration, you know exactly what you're getting. And so when you prescribe it, when a doctor prescribe it and you take it according to the prescription, you know, chances of you having an overdose is very small. Although now more and more days where patients we know that have chronic pain that are prescribed chronic pain medication, they're also prescribed the antidote just in case of overdoses. But what we worry more about are these sort of illicitly produced or non-pharmaceutical produced. They're not meant to be made by the regulated industry, right? And so they're packaged into all sorts of different forms. They could be packaged like a pill. Oxycodones can be laced with it. Marijuana can be laced with it. In fact, they've done statistics to show that very rarely now are street heroin pure heroin. There are over 80% of street heroin is actually laced with fentanyl. So it's very hard just to find heroin by itself because fentanyl gives a better high. It's cheaper to produce and you need less quantity of it, it's more potent. So it's just being made and distributed everywhere. And when you mix fentanyl with something else, it can be really particularly dangerous, like in combination with a heroin, just because it's so much more potent, right? Fentanyl is much more potent than heroin. It's hundreds of more times potent than morphine. So you only need a tiny bit. And just to show you how little you need, this is here the vial labeled heroin. You can see it's maybe like a half a centimeter of powder, but you only need a few specks of fentanyl to overdose. All right, and the other problem is because they're not regulated, we actually don't know what the concentration is on any of these illicitly manufactured fentanyl. So they could be a lot more potent than typically what we would prescribe as pharmaceutical fentanyl. So I'm going to play another video clip that talks about fentanyl myth and facts. This is done by an ER doc, and I'm an ER doc, so I kind of like what
fentanyl
this
is
person.
a synthetic opioid. Things like morphine and heroin are opiates that are made from the poppy plant, versus fentanyl is a synthetic made in a lab opioid that hits the opioid receptor. It's really potent. It's really strong. We use it in the hospital all the time. It's a really safe drug when used properly by doctors and nurses. But when it's really concentrated and people are using it at home, they can accidentally overdose very easily. It's a common myth that just by touching fentanyl, you can absorb it, but you really can't. And it's important that we emphasize and clarify that. It's so poorly absorbed through the skin that pharmaceutical companies actually spent millions and millions of dollars to develop something called a fentanyl patch. It's a very special way to deliver fentanyl in a patch that you wear. And even then, it's not very well absorbed. But definitely the powder or pills or anything that you find, not really absorbed for the skin. People who have an opioid toxicity, opioid overdose that ingested some fentanyl or injected fentanyl, they have minutes, maybe just moments to live. So pausing, putting on whole body suit, PPE, or waiting for other people to arrive means that person might die. So we really need to intervene and help them as quickly as possible. That might be by doing CPR. It might mean by giving the antidote, which I carry with myself all the time, Narcan, naloxone. So we have just moments to do that. And so waiting because we're concerned about.
Okay, so again, the message that I want to give here is that one, recognize that this is a possibility and be on the lookout for it. And we're going to show you later on how to deliver naloxone, which is the antidote to an overdose. And that there are some myths out there is that, I'm not saying go charge into a situation but you don't need to put on like excessive PPE if you suspect that somebody has, or these are personal protective equipment. That's what PPE is. But a pair of gloves is okay. I think we see people all the time saying, oh, well, somebody's overdosed. I should, not go over there and help them because I might overdose from fentanyl too. There are instances like that, but I think a lot of it may be that it's a powder. There's some other way of delivery, but certainly just touching the person isn't going to put you at risk for an overdose.
Significant amount.
All right, so out of all of this, let's see. So which one of the following is not an opioid drug? We sort of talked about this. And again, like when we go through them, morphine, fentanyl, oxycodone, Advil, or none of the above. Anybody want to take a guess?
Advil.
Advil, yes, right. So that one we give all the time for kids with fever and just pain, but all the other ones are opioids. Okay, so I'm going to talk a little bit about Maryland overdose data so you can see. So in 2021, there's a link down here that's a Maryland Vital Statistics dashboard. But all this data is from the state of Maryland. You can see that there's a dramatic increase in fatal overdose death in Maryland. From about 2016, you can see that compared to 2015, we've just about doubled, right? In 2020, we were at 2,100, which doubled what we were 5-6 years ago. So that's certainly concerning. And I don't have more recent statistics, but there is an increasing trend in overdose related death. And you can see that the fatalities are mostly due to this green line here, which is fentanyl. All right. So everything else is kind of a slowly upward trend, but fentanyl is significantly the key contributor to overdose death. And if you look at the primary cause over death here, again, this is just a number. It shows you that most deaths are due to fentanyl, some due to stimulants like cocaine, but majority are due to fentanyl. And then if you look at the age groups, although I think it's very reassuring to see that majority are over the age of 25, but we still see that there is still a significant number for that population. So I think we still need to educate our youth about this risk that they're going to encounter when they go off to college, when they're in high school. Even middle schools nowadays, we're trying to educate middle schoolers about this issue. And that majority of these overdoses are in males versus females. Okay, this is another one that, just ask you to consider which one of the true. Females are more likely to die from opiate overdose related overdoses in Maryland. Fentanyl is the leading cause of overdose death in Maryland. Death from overdoses in Maryland has stayed the same for about the past 10 years. And then in Maryland, most opiate-related deaths are those under the age of 25. What do you guys think? Which one is true? B, I heard. Great, yeah, right? So we talked about this. I hope I'm hitting home that fentanyl is the leading cause of overdose death in Maryland. And we know the other ones are wrong. Males are more likely to die. Death has been increasing for at least the past 5-6 years, and most of the deaths are over the age of 25. Okay. All right, so I'm going to pass it on to Ethan to talk about recognizing an opiate overdose.
All right, so what actually is an opioid overdose? So an opioid overdose happens when a toxic amount of opioid, either on its own or mixed with other substances, overwhelms your body's ability to handle it. So as stated earlier, when opioids are mixed with other things, it increases the sort of unpredictability and potency of everything combined. So overdoses can happen if you take either an opioid that's not prescribed to you, more than what's prescribed to you, again, mixed opioids with other substances, opioids that have been tampered with, or illegally produced or obtained opioids. So when you're overdosing, we did talk about respiratory depression. So you sort of stop breathing, right? Or your breathing slows down to a point where there's not enough oxygen in your blood, and then it causes your vital organs to fail, and then you die. All right. Does anyone know any signs or symptoms of opiate overdoses? You can also shout them out if you know any.
Constricted pupils.
Sorry?
Small pupils, I think she said.
Oh, yeah. Yeah, absolutely. Yeah, it's great. Respiratory distress, yeah.
Yeah, and so in this case, it's more of a slowdown in breathing. Typically, when we think about respiratory distress, we think about that they're actually breathing really fast. But in opioids overdose, it's actually a slowdown of breathing. So you're going to think about taking opiates is just putting your body into a deep sleep. So everything slowed down, including your breathing. Coma, good.
Yeah.
A seizure is not typically seen in opiate overdose unless it's part of some other underlying process. So if they mix with a stimulant, sometimes you can see seizures. Typically, you do not get seizures with an overdose opioid. It really just causes you to slow everything down. Now, it can if you're predisposed to having a seizure. For example, if you have an underlying seizure disorder and you were deprived of oxygen for a long time, you can't have that. But it would be unusual just in a pure opiate overdose case.
All right. So other than the ones that were already mentioned, you know, we have slow breathing, unconsciousness. I know someone said coma, concise pupils, snoring or gurgling noises. So this happens because normally when you're like asleep, you know, your brain still has these, you know, unconscious processes that kind of prevent this, or, you know, that prevent kind of your tongue from falling in the back of your mouth. But when you're overdosing, you kind of fall into such a deep sleep that it doesn't really do that. So that's why you sometimes get like a kind of gurgling noise or like a snoring sound. Limp body, lips and fingertips turning blue or gray, or pale or clammy skin, or some people may have a slow or erratic pulse as well.
Yeah, again, everything is sort of more indicative of either a lack of oxygen, because you're not breathing. That's why everything starts to turn blue. You just don't have oxygenated blood circulating through you. But everything else is sort of your whole body slowing down. And I think pinpoint pupils are really hard to tell. Unless you're a medical professional, I think it's very hard to define what is your pinpoint. The idea is that opioid actually causes your pupils to constrict. So it becomes really, really, really tiny. But I think most of us are not going to be, if somebody's unresponsive, we're not going to be spending 5 minutes studying their pupils to decide if they're pinpoint. But some of the other more obvious signs, obviously, is kind of gurgling, snoring, not responding, turning blue.
All right, we have a quick true false. Opiate overdose affects the person's ability to breathe, which causes death.
Does that sound like true to you guys?
True.
I think I heard yes. Yeah, so we talked about opioids causing respiratory depression, which is what eventually causes a person to die. So.
All right. Now we're going to talk about Narcan. It's sort of like the antidote to overdose. So when you overdose, talked about the body having opioid receptors. The opioids bind to these receptors, and then when too many of them bind, then your breathing gets slowed down. You know, it impacts your breathing. So naloxone, or Narcan, is a medicine that reverses the effects of an opioid overdose and restores your breathing. It can be delivered through your muscles, your nose, your veins, but unfortunately it is fast acting and it wears off in like 30 minutes to 2 hours. That's an important point to remember. So your body has those opioid receptors and the opioids bind to those receptors, but naloxone actually sort of kicks them off for a little bit and restores your processes to normal. All right. Do you all think it is safe to give naloxone to anyone? All right, we have a yes. So it is actually safe. There's no evidence of harm to pregnant women. It's safe to use in children. There's not really a potential to misuse it. There's no serious side effects. It does trigger withdrawal. So if someone overdoses and you give them Narcan, then they're going to probably wake up very annoyed, confused, and puking. And naloxone is only effective in reversing opioid overdoses. So if someone's like, you know, having a heart attack and they're down on the ground and you give them Narcan, it unfortunately won't do anything.
It won't do anything, but it also won't hurt them. And I think that's an important thing to remember, which is that you can, because when we looked at the signs and symptoms of overdose, they can mimic a lot of other conditions, right? So for example, a person having a heart attack, a person having a stroke, or something else that they could be unconscious from. So it's not harmful to give it to them. The worst case scenario, it doesn't work. All right. But it is important to consider that if you're in a scenario where your kids, you know, they're at a party, and it's very unlikely for a 20-year-old to have a massive heart attack, right? So if they're unresponsive and they're turning blue and they're at a party, the first thing that comes to mind is that this could be an overdose. So that's the scenario that we want to paint for the youth. If you're, you know, randomly on the street, somebody becomes unconscious, that's a very different scenario because they could be suffering from any number of medical conditions and not necessarily opioid. But it's just sort of the scenario that you're in.
All right, so you can actually get naloxone from a lot of pharmacies in Maryland. You don't really need a prescription or any proof that you're trained in using it. You can just walk in and ask for it and they'll give it to you. And you can also contact this email if you have difficulty getting it.
Okay.
All right.
Go ahead.
True or false, naloxone cannot be given to children or pregnant women.
False.
False, right, good.
False.
So everybody knows. Yes, thank you. How about this one? This is a little bit tricky. Naloxone can be given in all of the following except. So which way the naloxone does not come in? So it can be given as an injection muscle, injection into the vein, a spray in the nose, or a pill to be swallowed.
D.
You know that?
D.
Yes, yeah, it doesn't come in a pill. So excellent, you guys are paying attention, thank you. Yeah, you can inject in many different ways. You can give it in a spray, but it does not come right now. Okay, so let's pass it on to Isabella, who's going to talk to us about responding to an opiate overdose.
So as we said before briefly, there are 5 steps to responding to an overdose. Before you do anything, you want to make sure to protect yourself. This can be done by making sure the scene is safe. You can't help anybody if you are putting yourself in a position where you can get harmed. So make sure the scene is safe and then assume any white powder that you see is fentanyl and look out for other drug paraphernalia. And here is a figure to show a quick overview of the 5 steps. We'll go into more detail later, but step 1 is shout and shake, 2 is call 911, 3 is administer naloxone, 4 is start CPR, and 5 is to assess after doing these 4 steps what you should be doing next. So step 1, rouse and stimulate or shout and shake. The purpose of this is to try and get the person's attention, see if they're conscious. So you want to make a lot of noise, you want to like shake their shoulder and yell at them. You want to make a lot of noise, that's the general idea. And if that doesn't work, the next way to go is pain. So what you can do is something called a sternal rub, where you take your knuckles and rub it on your breastbone or your sternum. This is actually something you can do right now. It doesn't take a lot of pressure to feel that pain, but you just rub it up and down the sternum, and then that pain will usually stimulate someone to wake up if they are not like that deep into unconsciousness. Step 2 is to call 911. As we said before, naloxone's effect is only temporary. Ethan said about only 30 minutes to 2 hours. So you want to be able to give them like a more steady supply and not as short term of a treatment. The person may be also having other complications, either due to other underlying health problems or the overdose itself, or they may not even be having an opioid overdose, so they were going to need treatment for that. And then step 3 was using or giving the Narcan nasal spray. So this is a quick instruction on how to administer that. The most boxes come with 2 doses, and each dose is single use. So what you would do is once you open the box and you take out a dose, you'll peel the back tab to expose the spray, and then you'll hold the spray like a plunger with your middle and index finger on either side of the nozzle and your thumb on the plunger. You're going to insert the tip of the nozzle into the person's nose and then press the plunger up firmly. Like I said, it is one-time use, so once you push the plunger up, it doesn't come back down and you're going to have to discard it. And then step 4 is rescue breathing and CPR. This step, only do this if you are certified in this. This not offered through our training. You would have to go through like first aid or someone that does offer this. But quick overview, you want to tilt the person's chin up to open their airway, clear anything that's blocking their airway, pinch your nose shut, make sure you form a complete seal with your mouth over theirs. Blow 2 regular breaths, then give 1 breath every 5 seconds. If the chest does not rise, retilt the head and give another rescue breath. Again, only do this if you're trained, and even then, not many people are comfortable with giving mouth to mouth to strangers. You don't know where they've been, you don't know if they have COVID or any other diseases or anything. So this step is skippable. Again, most important step is making sure you can give them the naloxone if you have some of that. Step 5 is to care for the person. So you want to stay with them until medical help arrives. And if the person cannot sit up or if they're still unconscious, you want to put them in the recovery position, which you can see on the right side of the screen. So basically the recovery position, you bring their arm across their body. Well, you want the person on their side and you want to bring their arm across their chest. So this supports the head. And then their knee will also come across their body, and this prevents them from rolling onto their front. In this position, will prevent the person from vomiting, they'll choking, or prevent them from choking on their vomit if they happen to do so, and it'll prevent them from rolling forward onto their face into that vomit as well. You want to, if they're awake, you want to make sure you keep the person calm. They're going to be aggressive, they're going to be suffering through withdrawal, so you want to make sure that they don't cause any harm to themselves or the people around them. Want to encourage them to not take any more opioids. And if a person becomes unconscious again and you happen to have another dose, you want to give them that second dose of naloxone. And here is a quick video, just I think maybe a minute overview of the 5 steps that we just went over.
If you suspect someone has overdosed, try to get their attention by firmly rubbing your knuckles up and down the center of their chest. Next, call 911 with your location and the person's symptoms. Now it's time to administer naloxone. Peel back the package to remove the device. Place the nozzle tip in their nostril until your fingers touch the bottom of the nose. Press the plunger firmly to release the dose. Place the person on their back and tilt up the chin to clear the airway and support breathing. Give a second dose if the first one does not work within 1 to 3 minutes. Care for the person by rolling them on their side. Stay until medical help arrives.
So if you do happen to administer naloxone, the state is asking that you report this use to Maryland Department of Health. Using this report, this link, or you can call the Poison Center. Completely anonymous. They're not using this data to track you as a person. They just want to monitor naloxone usage and then keep track of the statistics within the state. And then a quick question. In responding to an overdose, you should always call 911 because A, you might need more naloxone. B, you might need help if the person is unconscious for reasons other than opioid overdose. C, the person could get worse, or D, all of the above. You can shout it out if you don't, or put it in the chat if you don't have the link open.
Well, let me see.
D.
D, yes, absolutely correct. All of these scenarios are reasons why you should call 911. Okay, so I'm going to talk a little bit about can you get in trouble, right? Because you're technically administering medication. You may or may not be a health professional. So is this something that you can do? And there's a thing called, actually most states have this. It's called a Good Samaritan law. And it basically protects any individual from arrest and persecution for assisting in an emergency overdose. So you don't have to worry that, if was fentanyl present at the scene and you go and help that person, can you be persecuted for possession, right? And you can't because you're trying to help the person. And also, even though if you're not a medical professional, let's say you give somebody naloxone and maybe they were unconscious because of a heart attack. You can't really be sued or persecuted for being a good Samaritan or trying to help somebody because you worry that there was an overdose, right? So again, these are laws that protects you. It doesn't protect you from other things. Like if you have an open warrant, hopefully none of us have that situation, but if there's an open warrant against you for something else, it doesn't protect you from that. For any other felonies or, and if you're any sort of other immigration status or university regulations, some universities actually have separate regulations, but in general, it does not protect you from something that's not related to you providing assistance. All right. And so we're going to go through just a few take-home points. Opioids can be prescribed or illicitly produced. So some of the scenario where an overdose can happen is a person in the family might have been prescribed an opioid, and maybe they have a small child that got into their medicinal cabinet and they take these, they happen to take the pills that was in the bottle. So that can certainly lead to an overdose, right? But it can just be something that a friend gives to them at a party, or smoking a joint that was handed to them, right? And I think Beth had mentioned earlier that a lot of these decisions are very impulsive. It's not that they plan to use drugs. It just happened that they happened to be there, and that, it was a scenario, it was an opportunity or situation that happened. And it tends to be more impulse related than actually planned. So we talked about fentanyl as the leading cause of overdose related death in Maryland, and that really the primary cause of death is effect on breathing, right? So basically it stops a person from breathing, and that really leads to death. Overdose can be reversed with naloxone, which is why we are trying to teach and talk about this session today, which is that naloxone is the life-saving antidote to opioid overdose, and that it can be safely given to any population, including children and pregnant women. And again, just to review, responding to an opioid overdose, you rouse and stimulate the person first by rubbing on their chest. You call 911. You deliver the naloxone in the form of a nasal spray. That's the most common way to deliver it. And then if you're certified, as Isabella mentioned, if you know how to do CPR, you can. But if they have an opioid overdose, that isn't going to be the main thing that's going to save them. It's naloxone. But if you are trained in CPR, go ahead and do that. And then just take care of the person until help arrives. So this is a real life scenario of somebody getting naloxone, and the clip isn't great, but if you look carefully, you'll see the police officer actually delivering the naloxone nasal spray to this child who happened to have an opioid overdose, and then you sort of hear them moaning and waking up at the end of the clip. But just to show you how fast it works.
Wait, where is it? Where is it?
Deputies in Alabama raced to save a 1-year-old who allegedly was overdosing on fentanyl.
Back up. How long has she been down? How long has she been down? Okay, everybody back up.
You see how you see the naloxone
shows the response. When a Jefferson County Sheriff's deputy finds the little girl sprawled out on the floor, he tries to look for a pulse. Then he administers Narcan, a nasal spray to revive people overdosing on opioids.
Come on back.
And Narcan is just the brand.
No.
You can see him delivering, and you can hear her kind of whimpering and
wake the
waking up.
child up, but she was then rushed to the hospital where authorities say she was stabilized.
So you can see it's pretty fast. Like they literally deliver it and it's instantaneous. They really wake up within like less than a minute. They do wake up. So there's lots of media. Our kids are out there on YouTube all the time about your kids. My kids are on YouTube constantly. And there's actually a dedicated channel on YouTube. I've read and watched most of these stories. And some of them, a majority of them are totally preventable. And I think what's important is that it's really about education and communication. Teach your kids about these scenarios that they could be, or somebody who's at a party with them who maybe is unresponsive, suspect that maybe they've had an opiate overdose. And what they learn about opioid overdose can save somebody else. So there was one instance where I read there was one girl, she went to a party with her friend, and the parents could track her on the phone. They knew exactly where she was. She was at this house that was at a party, and the parents became concerned when she missed her curfew, so she didn't come home. And then so they went out to look for her in the early mornings, even though they had her location where her phone was. They didn't know exactly which house she was in. And by the time they found her, she had already overdosed. But she was in this house for 11 hours unresponsive with all these people around her, and nobody suspected that she had overdosed. And this house was full of people. So it just goes to show you how important it is to be educated about these type of scenario, so that if you have Narcan or at least recognize signs and symptoms of potential overdose, you could at least call 911 for help, right? Rather than think the person is just asleep. So these are some additional resources that Maryland has that talks about the opioid response training program, and the Maryland statistics dashboard is also providing, it's a live dashboard that provides updated data to the vital statistics as well as overdose death reports. And this is this is CCACC, where we have the program. So if you are in, if you want to, you can, the office is in Gaithersburg, right, at Gaither Road in Shady Grove. You can go to the clinic during regular office hours, and they will give you naloxone for free that you can pick up. And you just say you attended the Wootton training session, and they do, so they will give you naloxone doses to you. They'll give you at least a box. And so this is our post-training questionnaire, but we're open to answer any questions if you have any questions about this, but we hope that you'll provide some feedback to our training, and let us know if you have, if you have any suggestions to make it better. So thank you.
Thank you, Dr. Pei. Is there any questions? This was an excellent presentation.
And I'm happy to share the slides and send it out to Brian, that he can distribute it with you all if you want to find more information or want to get your naloxone kits from the CCACC. Again, we're giving them out for free. So the state gave us, as part of this training program, they gave us, like, we ordered 4,000, so we have tons. We're not going to run out. So you can have 1, 2, 3 and put them in your purse, in your, you just can't put, probably won't recommend you put a box of naloxone in your car, because the extreme heat and extreme cold can affect the medication. But otherwise, like, if you have a book bag, a backpack, you can carry it, and it's totally fine at any room temperature. And I think it's good until 2026. So it has a long shelf life. It doesn't expire in just a few months.
That's great. And so it seems like everyone should have some in case it's needed.
Yeah. Thank you for having us.
Yeah, it's our pleasure to have you, and thank you for presenting, even though you were not feeling well. So really appreciate the presentation, and we'll post the slides so that they'll be available. And do you have contact information that's also on the slides, so that if anyone wants to follow up?
Yeah, you can feel free to reach out to me. And I want to say special thank you to Ethan and Isabella for helping. The idea is, actually, I have another slide. That's another one is, I forgot to post it, but we're also recruiting youth ambassadors, because I believe that, it is a hard conversation to have with teenagers. And I think what I'm trying to do is recruit high school students and college students who will go out and participate in the training. I will obviously lead the training, be there as the medical professional, but I think it's helpful if we have youth come out and talk to their own peers, because they speak in a language that's, that I think peers are more comfortable answering questions to their own peers. Or so I'm recruiting other high school students, and we do give SSL hours to participate in teaching and sort of preparing for the program. So if any of the parents, you have kids that are interested in participating, feel free to reach out, and we'll do a training. And as you can see, the content is very easy to deliver. It's really meant for the lay person. So we think it's really great to have community involvement into sort of spreading the word.
That sounds great. Ethan and Isabella, thank you so much for your presentation as well. And hopefully you can help with recruiting some students who can participate in such training, because it would be really good. Please join me in clapping for our, you can use your little emoji to show your appreciation for our speakers this evening. We thank you so much. This was a very informative presentation, and it is recorded. So, encourage other parents to view that recording, because I think it will be very useful for them as well. All right. Are there any other thoughts or questions? All right. Well, if not, we will see you at the next month's meeting, March 19th, with a completely different topic. So thank you very much. Thank you to our presenters, and I hope everybody has a great evening.
Thank you, everyone. It was great. Really appreciate it.
Bye, everyone.